Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show, bringing you to another really awesome guest today who's been involved in creating a better tomorrow on many unique fronts. Coming off of 7 years of leadership as Executive Director of the National Institute of Health of Pakistan, we have the honor of being joined by Major General Dr. Ikram, who is currently the director of the Pakistan Field Epidemiology and Laboratory Training Program, as well as chairperson of the Training Programs in Epidemiology and Public Health Interventions Network Advisory Board, which is a global network of field epidemiology training programs spanning over 80 different programs, actively training field epidemiologists in over 200 countries and territories. Dr. Ikram has a long dossier. Just to list a few of the things he's involved in, he is a board member of Gavi, the Vaccine Alliance, Executive Board, International Association of National Public Health Institutes. He's Executive Committee Institute of Safety and Technology and Research at the UK, Technical Advisory Group, Biosafety for the World Health Organization, and he also serves as adjunct faculty at Emory University, as well as ex-executive council of International Society for Infectious Diseases. We will put a long laundry list of everything else that he is involved in, but needless to say, he's an extensive experience working with international health regulations, global health security, One-Heath, biosafety, biosecurity. Dr. Ikram graduated from Army Medical College in Pakistan, did his Diploma in Pathology, qualified in clinical pathology and clinical microbiology, and then went on to do his Ph.D. in molecular biology. A long list of accolades and other organizations that he's involved in, but we will get into all that as we get into the show. We're honored to have him with us today. Major General Dr. Ikram, thank you so much for taking the time to come on the show today.
It's a great pleasure to be with you, frankly speaking, and I'm just humbled by the introduction. But frankly speaking, I think life is too short, I always say, to learn. So much more that is left behind. But I think in turn, it's not the credentials, it's not the expertise, it's what we do for the humanity and for the world is the biggest asset.
Absolutely. I couldn't agree with you more. Would love to start off, as we typically do, by handing you the floor for a little bit, just to talk a little bit more about the beginning of this amazing journey. You know, clearly, you has served both in the military as well as in public service for medicine, and looking back at some of I really enjoyed going through your papers, and literally from the very beginning, you were studying everything from bacteria to fungi to mycobacteria. What got you started down these two paths? Give us a little bit of the background here, because it is a really long, amazing journey you've been on.
Yeah, I would also regard it as a very amazing journey throughout. Well, once I started off my medical graduation, and I did, and frankly speaking, at that time I never thought that I would be a pathologist, and then going down to microbiology. Started off with the thinking, the usual trend is to be a surgeon, but as the luck would have been, I got into pathology and then to microbiology. And then I realized what a great field microbiology is. And frankly speaking, then I started working. There was so much more to explore. Had I been a surgeon or a medical specialist, I would not have had such opportunity to have a real look into deep down into a world and a totally different world. And from there, I think there was no turning back. I tried excelling in this field of microbiology, picking up so many things. And then I think once we moved on, I think started realizing that mycology is quite a neglected field in the developing countries. So studying those and bringing those things back to the country, I did establish a center at our own institute at Armed Forces Institute of Pathology. And then moving on to the true research, I think meaningful, which is much more meaningful for the country as well, because AMR is not on a country problem, it's a global challenge that we were facing with. And then I think as I moved on with my doctorate and my fellowships from abroad, I really wanted my students to jump up to a stage where they can perform, where they can compatible with the international standing, where they have huge learning. And side by side, I think the first time that I went to the United States for my bioelectron microscopy training, I had to undergo a biosafety course. And then the journey for my journey for biosafety started. And till the time I think I reached the zenith, I've been the chair of the board for International Federation of Biosafety Associations as well. And then tried to getting the credentials from US and other countries. And again, starting from awareness and to trainings, to methodical and structured trainings for biosafety in the country, and then moving on and on. And I never knew that one day I would be the executive director. And meanwhile, we were doing quite an uplifting within the institute. And then the global challenge, caught in the global challenge of COVID. And I think retrospectively, once I see that why I was there, I can easily realize that that probably the challenge was coming up. So I was there, and I think with the team that we prepared over the years and the involvement of all the stakeholders, we could manage the situation. I think one of the cruxes that is the COVID challenge, and Pakistan response has been highly appreciated and lauded at international level, including the WHO. So I think starting from nowhere, coming down to a level where you can deliver for the country, and in turn at the global level has been a key success, I would say.
Absolutely. Absolutely. And as you mentioned, these clearly you've had to deal in your positions over the years with many challenges. And I'd love to start off with the one that you mentioned at the beginning, because it's a major one, and we've done a lot of shows on it. Sometimes people joke with me, why are you doing so many shows on AMR? Because it's a very serious topic. And, I noticed again, in your publication history, you were running into many of these organisms in your own medical practice. You've published on methicillin-resistant Staph aureus and multi-drug resistant mycobacteria. I really, the one that stood out to me was a 2009 paper that you wrote. You ran into a case of Acinetobacter, which is a real nasty one. We talked about in our episode when we talked about bacteriophage. And recently, you wrote on sort of the progress of the National Plan of Pakistan on AMR. Talk a little bit about your experiences. Clearly, you saw this, like I guess many experts saw this problem coming years ago. It's a major problem still. What's going on specifically in your portfolio in Pakistan to address this scourge that's headed our way that we all know is coming? But
yeah,
please.
I must appreciate, you've really gone deep down into my papers. Thank you so much for that. Now, coming back, the AMR challenge. Well, I would say AMR is a huge global challenge. It's a silent pandemic that we are not realizing. And unfortunately, we are moving into a post-antibiotic era. Now, if you compare it with COVID, for years and years, we have been talking of any eventuality and a pandemic, more so in the form of flu virus, but we never knew that we would get caught in yet another virus, corona, that would totally change and turn the tables globally. And now, coming out of the challenge, I think we must have realization and a huge diversion towards tackling the AMR challenge. And right while I was a student and then moving onward in an academic profession with the research work side by side, I kept concentrating on this thing. And the multifold, you always need a multifaceted approach to tackle this AMR challenge. Fortunately, I came down to a level at the National Institute of Health where I could frankly start off with the National Action Plan that we prepared with the help again of donors and partners. And not only that, then we moved on to the finances and costing of that plan. And the model that I have been using with my team at NIH has been that we work with the donors and partners. The strategy comes from the NIH, and then we bring in the donors and partners. We work collectively so that no one works in silos and there's no duplication of work. Now, this is yet another problem in the developing world, that there's a huge duplication at times. And I think the strategic leadership is responsible to overcome that duplication, and precisely what we did at NIH. And then we put the things in order. Then we started implementing that national action plan after the costing. And once with the donors and partners, we tried to make a project successful. We would take it to the government for the sustenance. Now, again, the sustenance is the job of the concerned government. And that's precisely what happened in AMR as well, that you could get the governmental funding. And besides, we have been closely working with different partners like WHO, CDC, US, and UK as well. And for that, Fleming Fund got involved directly with the AMR project. And that was a key and success that we took to the government. And now we have sustenance from the government side. And we have evolved different labs within the country for functioning under the umbrella of National Institute of Health, whereby we not only help them on the technical side and guide them, we have been supporting them, and we have been uplifting their labs. And then we established the National Data Center at the National Institute of Health so that we again get all the data, analyze it. And what the politicians and the bureaucracy needs is a palatable data analysis which they can consume, and then they can have evidence and data update policies. So these have been the strategies which really worked with a country like Pakistan. But as I said, you need to have a multifaceted approach. Then you have to take into confidence the other regulatory authorities, like in Pakistan, we have the Drug Regulatory Authority of Pakistan, and then moving on to again the professional, and the exact precise usage of antimicrobials according to the requirements, again the hospital bed policies. And the most important, I think, is the infection prevention and control, which we really strategized very well. We took different NGOs into loop. We started off the trainings in different parts of the countries, and moving towards antibiotic stewardship concept, which again worked very well.
Yeah, that stewardship concept is so crucial, especially in with the One Health theme, that this extends not just to the human side, but to the animal husbandry and agriculture and things of that nature. So I appreciate that insight. In 2011, the United Nations Institute for Disarmament Research issues their Improving Implementation of Biological Weapons Convention report. You write chapter 12, which is entitled Biosafety and Biosecurity in Pakistan. And interesting, you start off the chapter with the classic Einstein quote about not knowing what weapons will be used in World War III, but that World War IV will be fought with sticks and stones. And classically, we think about nuclear weapons in that quote, but clearly this was in 2011. We've come further. We have CRISPRs, we have the gene drives. These technologies are everywhere. They're prevalent. They're cheap. Talk a little bit about, thinking back to this chapter, which was, it's 12 years ago now. Your thoughts on what you were thinking about then, because clearly we've advanced a lot on these fronts. We can't hold back progress in these therapeutic use, but there is, of course, dual use of these technologies. And love to get your perspective on, if you had to rewrite this chapter in 2023, sort of where do you go with it?
Yeah, I think that's an excellent question. But before that, I would like to delve one important aspect, as you already mentioned. And I thought the next question would be directly related to the One Health. Now, this is something very, very important as far as AMR is concerned, because I think the wholesome concept of One Health is going to transform not only the human side, but the animal, environments, and plant side as well, as we truly understand a huge number of antimicrobial being used for the animal, and especially in the form of growth promoters and so many tags that are attached to it. So I think, and then, I mean, the overuse and excessive use, I mean, again, going down to the environments in the sewage and all that, and again, affecting the total microbial system. That's, I think, one of the key areas that is going to be addressed in the near future. And it is, again, thought very well. And if you talk of FAO, WOAH, WHO, they're all combining together to work, I think, collaboratively, and that is going to be meaningful. Now, coming back to, as I said, I think my first taste of biosafety started from University of South Florida, where I started off an electron microscopy course. And I really like that because I have been very keen and interested in infection prevention and control within the hospitals. Now, once I think one of the game changers, the post-September 11, the anthrax letters have been the game changer in for biosafety and biosecurity, and that was the time that the whole world started concentrating about these things, and in particular under the United Nations, the Biological Weapon Convention. And fortunately, I have had a chance of representing my country a number of times at the BWC along with other stakeholders. So I think with all that idea, I think we started off working in that area, and that gave me an impetus to write and come up with this chapter, because the United Nations approached me for writing down, and I did that. But I think that was the very beginning of, I mean, huge thirst and momentum that biosafety and biosecurity would be taking up. The second game changer is just now, is COVID. I mean, there are two aspects. One was the intentional use. The second one was a natural pandemic coming out. And I mean, they have transformed the world now. So there is right now, there's a huge concentration of biosafety and biosecurity. But what we did in the country after that was we launched a very methodical way whereby structured training program started from awareness in different part of the country, and then picking up youngsters from there and moving on to the next level of training, hands-on training, triage, drills, exercises, and then finally taking them to the master trainer level. And we launched yet another concept, which was, I think, very much liked in general within the country and abroad as well, by the name of BioPrism. Just like Prism, I mean, the rays come and you split them into 7. So every master trainer is going to train 7 people as minimum. Just so we named the program as BioPrism, and we started off with Train the Trainer program, and then the things started exponentially. And I think one of the success indicators is, I mean, there's been huge evolution of labs within the COVID period, especially for the PCR, and not a single outbreak within any of these labs reported. And then that's a great success indicator. Now, side by side, I think I have had a taste of attending a huge number of training sessions, workshop in US and so many other UK and so many other countries with WHO and then the American Biological Safety Association. And that all again nurtured me coming down to the next level. And then the world started at the same time around 2009 and 2010 at the BWC, the dual use and responsible conduct. So we came up with the initial draft for the country as a code of conduct. They were basically the guidelines, and I really feel fortunate enough that I drafted that for the country. And after involvement of the stakeholders, it became a national document. And then we started training side by side at the academia for that as well. Now, moving on from there comes a time when definitely the Inter-Academy panel and John Hopkins and Tangent University were working at an international model which is applicable to all the countries. I mean, these are the codes, basically guidelines. They are not any part of legislation or act. It's a more of a human binding, that a human ethical binding, I would rather say, that you impose on yourself. And the outcome of all that was the Tianjin guidelines. And I think now, as we move on in the post-COVID time, there's a huge restructuring within the WHO as well. And it's great that we have got different technical advisory groups. One is on biosafety. We're working. Previously, I've been working with health security interface that covers of health security as well as biosecurity. And then now they have, again, a quadripartite One-Heath group as well, the dual use group as well. And then there's a biohub talking of repositories and samples and all those things. So I think this is going to change. These things are going to be the game changers for the future times. So starting from evolution, at the country level, even within the United States, I mean, where there was a huge number of training started off, as I said, following the anthrax letters. Similarly, I think patterns have been adopted by different countries. And overall, once I was in the International Federation of Biosafety Association, and I was really fortunate before that, while I was the vice president, vice chair, and followed by the chair of the board. While I was a young officer, I was the first person to get the Biosafety Heroes Award from IFBA. And that was basically based upon all the things that I could contribute at the national, at the global level. But again, I would say it was not my success. I always take it as my country's success, that I represent a country where we can deliver a lot. And I mean, under huge challenging environments, we were able to deliver. And as we move on, we will definitely continue to play our positive role, not only at the national level, but at the global level.
Outstanding. I'm going to talk a little bit about, and we'll get into some of the different programs that you were involved in. I mentioned in the beginning of the show, you've just come off 7 years of leadership of NIH Pakistan. Introduce us for a couple of minutes to the organization, because I went to the website, and obviously it looks a lot like our NIH, or the Center for Disease Control, and there's nutrition and health and vaccines and everything else going on. Talk a little bit about sort of 2017 when you were thrust into this role, because clearly, it's a heavy focus on all things microbes and infectious disease, but much broader public health purview. Take us back to 2017, if you would, and sort of introduce us to NIH Pakistan.
Thank you so much. I think I've been fortunate that I have been accepting challenges throughout my life. Even before joining NIH, I had a good number of projects, like establishing a medical college in one of the cities in Pakistan, then National Universities of Medical Sciences. And I think with all that I've been working in policy making, representing the Army Medical Corps on the civil side, I think once I moved on to NIH, I think the biggest challenge was NIH, because NIH, the main task that was given to me was total uplifting of NIH so that it becomes compatible at the international arena. I think first few months were extremely difficult, because I needed to understand the intricacies from coming down to one side to the public sector. And at that time, unfortunately, the things were not that good within the institute, and hardly any production of vaccine, which is has been one of the components for NIH. Now, moving on, we started strategizing again. It was 24/7 that we started thinking, strategizing, moving on, discussing with the donors and partner, Ministry of Health. And the biggest thing that I think was the confidence reposed by the government and the Ministry of Health within me at that time. and I definitely wanted that I should come up to their expectations, and that's exactly precisely what happened. So we started working on strategizing for surveillance and public health. There were for years we have been talking of public health labs, but only within NIH, and no other public health lab was existing. And within no time, we started working, and we had the regional, the provincial capital labs for especially dedicated to the public health. Side by side, we started working on a surveillance system, and we are among the pioneer countries which launched the integrated disease surveillance and response system within the country. And we piloted it in one of the main provinces in Khyber Pakhtunkhwa, and from there we brought it to federal area, and then we went throughout the country in establishing that. And over the years, we kept adding, and now we have 155 units working in each district. And not only that, we established them, we trained their people, and we strengthened them, and then integrated into the national data center that later was established at NIH. Now, similarly, I mean, I think the vaccine was one of the key areas, and I have a strong passion for manufacturing vaccine within the country. So we rejuvenated the measles unit, which was shut down for 7 years, and it started producing rabies vaccine, so many anti-sera, and our anti-snake venom is basically a quadra anti-snake venom, and it is highly regarded at regional level. And I mean, we strengthened that. We established 2 new anti-sera production units within NIH, which were long pending for more than over 14 years. And it was fortunate that I could grab those grants back to do that. And yet another story is that one of the units that we again started utilizing for COVID vaccine production, which is a joint co-venture with one of the Chinese firms. And then moving on to other sides, we tried to elevate the standards of our drug department, which was there for quite a number of years, and then started working on real, actual evidence-based data and research. I think that the missing component was precise research, which was required for the country in the public health sector. Now, as we moved on, we started strategizing for establishing a CDC. And around 3 years back, I think we had another act by which there were 7 institutes underneath a National Institute of Health. So it became National Institutes of Health. We had a CDC Pakistan looking after the surveillance and all of those aspects, and the IDSR was integrated with that. And then again, the FETP's training, the Field Epidemiology Training Program, which was over a decade and was being run very successfully through the support of CDC. And there was a huge pressure on me that the government should take over the program. I mean, that was coming from the CDC side, but I was always appreciated what the CDC had done over the years in establishing, and our programs during this my tenure got 2 years. We got the Clinical Director Award from CDC. So that's again yet another big success indicator. But again, based upon the model that I told you earlier, we took this to the government, and we could get the sustenance for FETP for Pakistan. So it has been institutionalized, and it is also now working and fully functional through the government funding. And similarly, the integrated disease surveillance and response became a successful plan, and we took it to the government, and again we got the funding for future sustenance. Now, then the public health network, and along with that, during COVID, we established a Center for Genomics within the public health lab side, and that provided an umbrella to the public and private sector. Anyone who wanted to join us, we were open. And that's the policy, I mean, during my tenure, that we wanted everyone that should work, we should work together to make it much more robust and, again, meaningful for the country. And as we moved on, we now have a biological production separate center, again in Mall. And yet another key success was that based upon our performance and huge assessment, we were selected for the messenger RNA technology transfer. And that's again from WHO, the hub and spoke model. The hub has been established at South Africa. And Pakistan was among the first 5 countries that were accepted for this technology transfer. Our teams have been trained twice at IVI Institute in Korea and at other places as well. And now we are again in the process of moving on in this regard. And then we prepared a policy for vaccine manufacturing within the country. And then not only that, I did analyze the previous studies that we're conducting. And based upon that, we again proposed a model to the government, because I think health is a security issue. And vaccines are, I think, the best part of health security to be there. So we started boosting our production, and I think that in turn also was responsible for financial sustenance of NIH as well. And then for quite a number of years, I would say, we've been talking about occupational safety, but none existed at the national level which could guide. So another center was established for occupational safety, and we were already working on infection prevention and control, but that is one of the aspects, because it just belongs to the hospital. But moving beyond to so many other things that are covered under occupational safety, we started doing that as well. Yet another thing was, I talked earlier, was the health research. And as I told you that we had previously Pakistan Health Research Council, which over the years had gone a bit redundant. And so it was placed under a National Institute of Health as Health Research Institute. And we started focusing on thematic research. And I think we had a new board by that time. So we had retreats on that. We strategized all that, and then started dishing out grants which are much more meaningful and definitely worth much more than they used to be in the past. And I'm sorry, I can go on and on, because there's so many things that we kept adding. But I think all in all, this has been a huge package. And that was the reason that the 17, 18, and 19, I think we were quite well prepared with so many things that once COVID was there, we could strategize on really very rapid pace of expanding the surveillance, trainings, then moving on to different parts of the country, putting in the vaccine strategies and all those things. And the most important thing was the diagnostic. And we were among the top countries which started reporting the COVID testing and response within the same day, which again was a huge success for a country like Pakistan. But overall, I mean, coming down to the COVID challenge, the government formed the National Command and Operations Center, comprising both the public sector and the military component. And I think that was a big booster for the country, because the leadership and the teams worked so well under the able command that the things were really defined, making strategies which were implementable all across the countries. And not only that, monitoring all those things, going down to even availability of different medicine, treatment, even oxygen. And I think the key was the vaccine strategies, because for the first time, National Immunization Management System was launched even before the availability of vaccine. And so once the vaccine was there, so we were been very successful, because despite whatever we call the infodemics and all those, and against vaccines and all those things, myths and conspiracies, we are, I think, topmost countries in the developing world, whereby we had around 91% full vaccination for 12 years and beyond, and almost 94+% for partial vaccination. So I think that's yet another success indicator. Now, after that successful working of the National Command and Operations Center, it was transitioned to National Institute of Health at CDC NIH. So I think these are the key successes. I think they are there. And as we move on, I think the next leadership would be further strengthening them. Back to you.
No, thank you for all that. I mean, it's an amazing portfolio. Again, a lot to take in, and but you were there for 7 years, modifying and building this amazing set of programs under the institute. One thing I'd like to ask about, because again, going back to your publications, a theme that I saw during this time period in sort of what I'll put in the basket of innovative drug development were several projects, and I love these, where you're merging together sort of the cutting edge technologies that you were just mentioning with whether called indigenous knowledge or knowledge from nature. Things that stood out to me were these nanoparticles that you were working on, derived from this interesting palm tree fruit. There was another paper where you were combining this peptide toxin from wasps with chitosan nanoparticles, and then you have a bunch of papers on the microbiome, the beneficial side of the microbiome, which I believe is an uncharted area. Just you were connecting it to heart disease and type 2 diabetes and things of this nature. Say a few words about this as well, because I, again, personally, it's extremely interesting to me because I think we have still quite a bit to learn. Although we have the CRISPRs and all these tools, we still have a lot to learn from the natural world. Talk about this for a few minutes, if you would, too.
Yeah, this is the second time that definitely you mentioned CRISPR, and I think CRISPR-Cas9 is just the tip of an iceberg. Right. I mean, I think, and it's something very important for the scientists to really think seriously about that, and that's why the responsible conduct and dual use research are one of the things that remain on the horizon for some time and will remain on the horizon. Because why? Because I think biotechnology is a very rapidly growing field. And I would say, I used to say this a decade back, I started off, that biotechnology is going to take over and transform the world. But I truly believe we have seen that now. And CRISPR is just one example. And there are so many others. Now, I really got intrigued by all these things. And once I started having my doctorate students, but before that, I have had a chance of working with the different academic institutes and reviewing the proposal even within the country, the Higher Education Commission, and I've been co-chairing the biological sciences over there as well. I mean, that gave me an insight what was happening at the international arena and where the things stand within the country. And if we have to progress, definitely we have to jump up to the next strengths and definitely slowly and gradually move on to that. So once I started moving on my PhD students, I really I told them that the time you decide your basically the topic of your thesis, you would be doing half of your PhD, because that's the crux. And if you want to work with me, that is your success, you come up. So, I mean, they used to think, come back, but then you kept guiding, and that's how I guided them to microbiome, which is in a world in itself existing within the human being. And most of the people, even from the medical side, even are not yet aware how much this microbiome is important within the human being in itself. And out of my intrigues, and this, frankly speaking, we started working in, starting from very basic, diabetics versus non-diabetic. What is the difference between my microbiome? And once we moved on to jumping on to microbiome on other, we started getting so much of information with metagenomics, especially in particular, that just to quote you one, I'm very keen because in one of the samples we could detect a rifampicin resistance E. coli within the gut microbiome. Now, that for a person like me was a serious thought. A country with huge burden of tuberculosis. Now, what if this organism is present in most of the microbiomes, and how it would start making the patient's rifampicin resistance And it's just a simple, I mean, these microbiomes have multiple ways of acquiring these genes and parts of genes and getting those within that. So, I mean, just giving you one example. And similarly, I mean, I think nanomolecules and nanobiology has been one of my key areas that I wanted to focus. And that's how we started studying that, how we can further, because I think in the future, we right now we do talk of nanocars, precision medicine, that nanocars, nanomolecules loaded with a certain drug, and just precisely entering, once we enter the human body, they would precisely go to the target and hit the target. And I think talking of chemotherapy in the future would be, we are not far from that place now. So these were the things that kept me moving in this area, and we started, for the first time, going down to that level of research within the country. Metagenomics, and then getting back what else could be done in this area, and so many other things, and much, as I said, much more to do.
Absolutely. Yeah, I just again, it was I find those intersections quite elegant. So I just, again, they stood out to me, and as I was reading about you, so yeah, I take my hat off to you for working in those spaces as well. So let's talk a little bit about what you're doing now, because as I mentioned in the bio, you are the chairperson of the TEFINET, the Training Programs Epidemiology and Public Health Interventions Network. Clearly, these folks are the front line to highlight, to investigate, to ultimately prevent these spillover events if we find them early enough. We did a little profiling on, what we have here in the U.S. in terms of the CDC and our Epidemic Intelligence Service. What are you doing at TEFINET now? What are some of the core, as we sit on the cusp of 2024 now, what are sort of the critical issues that you think about as you train this next generation of field epidemiologists that have to go out and find and predict what's happening with all those other nasty things that live in the natural world?
Well, that's a great question. I think TEFINET over the years, and again, courtesy of CDC, has produced an immaculate force. I call them soldiers on the ground. And that's exactly one great example is COVID. Well, all over the globe, I mean, now it's almost more than 100 countries. This force basically worked practically not only surveillance, but moving across, training, vaccines, guiding about vaccine, and so many other things that it's a long list, I mean, that they're doing. Coming back to our own country as well, I mean, where we had at that time around 250 graduates of 2 years course, and they were thoroughly utilized, and not only that, also as master trainers. Now, there are two things. One is the experience coming out of the COVID and seeing the country demands. That is one aspect, and other is globally. I'll come down to the global part as well later, but I would say the time has come. I am again very advocative that there are certain areas. Now, we get a great curriculum for 2 years, but we cannot then overstress. We can introduce to certain topics, and these topics in my which are very important globally are the climate and environmental hazards. We talk a lot about these days. Biosafety and Biosecurity, One-Heath, AMR, non-communicable diseases, and I mean, also talking in perspective of fragility, equity, migration, and unfortunate instances, natural, unnatural hazard that the world is really facing globally. So, in my opinion, you have a 2 years of great training course. The candidate qualifies that, and then they can join a subspecialty. I mean, they remain as Epi Intelligence Force, but side by side, maybe 3 months course. And that's what has been experimented recently in climate. The UK launched, and Pakistan team also joined them. And I think that's going to work a lot. And this is just one example. But moving on to, as I've already been discussing within the board as well, and I think we are not far from where we would be launching courses and maybe prototypes prototype within the country that are existing, picking up that curriculum, enhancing that, and setting it as a role model for the world. And I think these are very critical areas where this task force can really work together and come up. Yet another good thing is the networking. I think it's a great networking between the FETPs all across, and TEFNet in particular, and the global task force also provide them opportunities to come together and work together. And that is again very important at the global level. One thing that I said earlier is a new launching that has been of global field epidemiology partnership. It was launched last year in Berlin at the pandemic hub in Berlin, and basically it's a collaboration with TEFNet, WHO, and CDC joining hands together. So I think this would boost the efforts and again strengthen parts which may not have had that much of importance in the past, but now after COVID experience, I think the global challenge and the climate change in particular, I think these things are going to strengthen. My vision would be adding on all these things as a subspecialty so that we have a much more prepared task force for any challenge that we can come across.
Let's talk a little bit about, you've been on the road a lot recently. You were in Zambia for the Lusaka agenda. You just came back from the Gavi meeting in Ghana. You're all over the place. You're keeping quite busy on these broad global public health issues. Can you tell just a couple of minutes on each of what's happening at those particular initiatives? And then I noticed, getting into 2024, you're not slowing down. I see at some AI conferences in a couple of months. What's coming up? What should we be aware of? Where are we going to run into you flying around the globe as we enter the new year?
Yeah, I think you know more than myself now. That's really great. I mean, I really appreciate that. And just coming back to your point, I didn't go to Zambia because I was committed somewhere else, but I did go to Wilton Park meeting in UK a couple of months back on Lusaka agenda. Now, but I would like to talk a few words about this. I think because the time has come during the post-COVID when we are talking a lot about health system strengthening. Yeah. Whether you talk of World Bank, whether you talk of Global Fund, whether you talk of Gavi, everyone is concentrating. I think this Lusaka agenda is going to play a pivotal role. Now, it talks of two very basic things. And though it has 5 main objectives, and that is again very much achievable at the country level. Now, the thing is that they talk of primary healthcare and universal health coverage to start with. And I think these have been talked for years, but now is the time that all the global donors, partners, and main stakeholders are talking of health system strengthening. The countries must take the benefit. And the main crux revolves around one plan, one country. You see, the donors and partners working at most of the places I did mention earlier, they do work in silos, which may not be profitable in the long run. And they come, they have their objective, they deliver, and they go back. Another donor may be duplicating yet another. That's what I saw once I joined NIH. There were even triplication and quadruplication of efforts, and that went wasted, unfortunately. So we want the donors and partners when in the world where we post-pandemic time, we hear about the donor fatigue. This is the time. So this Lusaka agenda is going to be very important because it talks of one strategy, one country, and that's going to make things much more meaningful in achieving those objectives. And there's nothing high-tech into it. And now it is out, and hopefully as we move on further with the discussions and negotiation with the country, I'm sure it's going to be very, very meaningful. Now, coming back, definitely, as I said, I have had a passion for so many things, and I think everything revolves around, and the future world is your AI, and everyone is not only interested, but also worried as well, that how far it could go and how you have to basically control the AI rather than the time comes when the AI controls you. So this, having said that, I think there's a huge role of AI in medical side as well, medical sciences. And I think I was invited for a talk on a role of AI in medical sciences at one of very important institutes, LUMS in Lahore. And I was giving a talk, and just before 1 minute before the talk, I received a call from NIH that we have detected the first case of corona in Pakistan. So you can well imagine giving a talk on AI, but what isn't going in my mind? So I just finished the talk. I took some of the question. I sat in the car, and I just rushed. It was evening time, and I just rushed back from Lahore to Islamabad to take care of the situation. The thing is, the future is AI. But again, I would say it's our duty to control the AI, to limit it to the extent where it is required. Let's see down the line. But yeah, you're right. I've been jumping for the last 6 to 8 months to so many countries, and but I feel really fortunate that I get these opportunities not only to learn, but to deliver for my country, and then in turn at the global level. And getting these opportunities and then translating them into meaningful actions at both the levels, I think I take it as an honor and a pleasure as well for myself.
Well, I hope you don't get worn out too much from, I know travel can do that. It does it to me, but no, it's going to be enjoyable to continue to watch you on the circuit and see what you do next, as you mentioned, as you continually to work not just on the public health initiatives in Pakistan but globally. And it is such an interconnected world. And I take my hat off to you. It's just an amazing journey you've been on, and I thank you. Just so much for sharing it with us. Again, for everyone that is going to be listening to this particular episode of the show across the various podcast networks or watching on our YouTube channel, again, you've been listening to Major General Dr. Amara Ikram, Director of the Pakistan Field Epidemiology and Laboratory Training Program, as well as Chairperson, Training Programs in Epidemiology and Public Health Interventions Network. Amara, I really want to thank you. It's an amazing journey. I really appreciate you staying up and sharing it with us, letting us know what you've been up to. Obviously, thank you for everything you do and continue to do around the globe for public health. And again, as we like to say on our show, thanks for helping to create a better tomorrow via what you've been doing and what you continue to do. It's really a great story.
Thank you so much from my side as well. It's been a pleasure to be with you. And again, the message is that together we have to sail, and let's join hands together to make it a much more healthier and a safer world. Thank you so much.
Outstanding. Wonderful message.